Today we are starting our new unit, Ocular Appendages, and today is the first lecture of this unit. First of all, we will see the movement of the eyebrows. Upward movement of the eyebrow is done by the frontalis muscle. Downward movement of the eyebrow is by the orbicularis oculi muscle. Medially, corrugator superciliary muscle is involved, and all this information is taken from the Snell's Ocular Anatomy. And what are the lymphatics? Medially, submandibular lymph nodes, and laterally, superficial parotid lymph nodes. So this is the lymphatic of the eyelid. Important one. We know that there is a lot of sensory supply to the eyelids. So whenever we have to perform any surgery, we have to give the anesthesia. So the local anesthetic injection to block the sensory supply to the eyelid is given deep to the orbicularis oculi muscle. In hypothyroidism, there are a lot of signs and the symptoms present in the eyelid and the structures around the eyelid. So the most important structure is that the lateral 1/3 of the eyebrow hair are lost. Okay, lateral 1/3 of the eyebrow hair are lost. Now we will study the structure of the eyelids and its related structures in detail. First of all, note that upper eyelid is larger and it is more mobile. What is the function of the eyelids? It protects the eye from the injury and it protects the eye from the excessive light. The eyelids also distribute the tears over the anterior surface of the eye by blinking mechanism. Okay, whenever there is blinking, the eyelids come in action to distribute the tears over the anterior surface. Now there are different structures present around the eyelids. We will see these structures one by one. So let's suppose this is an eye. We can say that this is left eye. So eyeball will make here pupil cornea. This is the medial end. This is the lateral end. Where the upper and the lower eyelids meet, the structure where the upper and the lower eyelids meet are known as the canthi. This is the medial canthi, and this one is the lateral canthus. A small pink elevation present at the center here. This is known as the crancula lacrimalis. Okay, lacrimalis. the structure which separates this elevation from the rest of the eyeball. This structure, this is known as the plica semilunaris, present in the medial canthus on the lateral side of the caruncle. So this is the plica semilunaris, present in the medial canthus. I have already told you that this is the medial canthus. It is present on the lateral side of the caruncle. This is the lateral side. Okay. So this is plica semilunaris. This is caruncle. And this triangular shaped structure now formed. This one. This is which separates the two eyelids. This is known as lacus lacrimalis. Okay. This one is the lacus lacrimalis. It separates the two eyelids, triangular shape structure. What is papilla lacrimalis? Small elevation 5 mm from the medial angle. As the eyelids move medially here and here, there is a small elevation present. This is known as papilla lacrimalis. Papilla lacrimalis. Okay, papilla lacrimalis. And a hole present on the inner surface of the papilla lacrimalis. This is known as the punctum, or we can say that this is the lacrimal punctum lacrimale. This is the present superiorly is the superior punctum, and inferiorly is the inferior punctum. Punctum lacrimale on the summit of papilla and leads into the canaliculus lacrimalis. Canaliculus lacrimalis present here. It opens here, there, then. Okay. I hope all these structures will be clear now. The next structure important one is the gray line, also known as the slide sulcus. So what is the gray line? Gray line is the junction between the skin and the conjunctiva. It divides the eyelid into two parts, anterior and the posterior parts. Okay. The gray line is also referred to as muscle of Raynaud, and it represents the pretorsal articular muscle on the eyelid margin. So, related to the muscle of Raynaud. Gray line is very important during the surgery. An incision posterior to the gray line along the eyelid margin demarcates the anterior lamella from the posterior lamella of the eyelid. Okay, so that's why this structure is very important during the eye surgery. So let's read gray line from the Ramay. In the upper eyelid, grayish line between the eyelashes and the opening of the ducts of the dorsal glands, also known as the Meibomian glands. It serves as a plane in which eyelid can be split open with the minimal scarring. I have already told you that this gray line is an important structure during the surgery. Gray line at the end of the eyelid. This is a very important point asked repeatedly in the MCQ, is formed by the mucocutaneous junction. In the upper eyelid, the LPS Levator aponeurosis. Levator is analogous to the capsulopalpebral fascia of the lower eyelid. Both retracts the dorsal. And we have already studied that muscle of Rylon is related to the gray line, is part of the orbicularis oculi, and it is situated near the lid margin. Eyelashes, not very important, but you should know that there is are 150 in the upper eyelid and half about in the lower eyelid, and these are replaced every 100 to 150 days in about 3 to 5 months. Now we will see the MCQs which can be asked from these topics. First MCQ is the triangular structure that separates the two eyelids is called as. What is that structure? Muscle of Rylon is part of which muscle? You can give the answers in the comments to get the final answer. That was all about today's lecture.